With profound humility, I welcome you to this our special parallel event holding today in the 67th session of the Commission of Status of Women in the United Nations. It is my pleasure, it's a rare privilege for me to address this great audience. Center for Public Health has been in the forefront, fighting and working towards getting a good health for women, especially maternal and child health. As the world is progressing through the globalization, the inclination now is through telehealth and telemedicine. Unfortunately, most of our rural women in the developing countries are being left behind because of inequity in distribution of the modern information technology that is vital in delivery of virtual healthcare system. It is our pleasure to tell you about our experience we have seen while working in many African countries, especially in the rural areas. The high mortality rate, infant, maternal, and child under 5 is because of financial and geographical barrier. These social determinants of health have not been abated because of poor development and poor awareness. What we are trying to do with our virtual healthcare is using telemedicine as a hub of intervention that includes reduction of domestic violence, employment of women, and quality care to the women and their families using the modern information technology. The problem is, how will all these women queue into this program without having the information technology infrastructure in their vicinity? But there's a way out. If the whole world will come together and we speak in one voice to ensure these women have access to information technology that will enable them benefit in the three-pronged action of having a quality health care, being protected from all manner of violence against women and girls, and at the same time being empowered through a microfinance loan, which they can access over the phone through the information technology. It is our pleasure to announce that we have achieved great success in some of the communities who have tried the prototype. It is quite welcome, quite efficient, and quite productive. The return on investment is great and enormous because we can all know the psychological effects of domestic violence, violence against women and girls, inequity has on our women. Psychologically abused, emotionally abused, but with telemedicine and telehealth, counseling, psychiatric intervention, earlier enough helps to always abate the resultant consequences of this psychological trauma. Center for Public Health also established 10 million voices. I'm happy to announce that we are now in about 43 countries with 65,000 volunteers who are ready to speak with one voice against domestic violence, to improve the healthcare system of the women, and also to create an access for virtual healthcare. The obstacle is there, but we will overcome. With 65,000 voices speaking at the same time all over the world, by the end of this year, our target is to reach 200,000 volunteers. The world you will hear from us very soon. We are going to speak. We are going to talk to the people. We are mobilizing people to create that demand. If the healthcare system is moving towards virtual healthcare delivery, our women in the rural areas should be part of it. We are also not forgetting about the ghettos in the urban areas, what we call the rural cities in urban cities. They will also be carried along We know the dangers of inequity in these areas. We also seek for partnership, collaboration, networking in the form of materials that we need to refurbish our adopted healthcare, primary healthcare systems all over the world, in the form of materials, in the form of technical advice, in the form of financial support to help us reach out the people who are very difficult to be reached. Also help us to reach out our projects. We are also advocating in an unmistakable terms that menstrual pad should be classified as a health materials instead of a sanitary materials. Do you help them to attract lower taxes or zero taxes in many countries? We are also advocating that all the menstrual materials should be placed in public places because some of these things can come as a health emergency. I've seen several times in the airport, in the schools, in the churches, where women are running helter-skelter to help themselves when suddenly the menstruation occurs. This is an issue of inequality. If government and other parastatals and other corporations can provide free condoms, nothing will stop them from providing free menstrual pads in all the schools, in all the public places for women to have access. Is having menstruation with dignity. We are also advocating that women should be granted a special access to funds for empowerment. Call it refundable loan or grant, because we know that when women are empowered, they are well positioned to defend themselves. When women are empowered, they will not be weakened when it comes to domestic violence, violence against women and girls in all forms. It affects the child. We're also calling for stability in the family. Family being the smallest unit of the nation, of the community. If the family is sick, the whole nation will be sick. Currently, our projects, our programs have expanded to about 6 countries. We are in Kenya, we are in Zambia, we are in Tanzania, we are in Rwanda, we are in Sierra Leone, and now we are registered in Canada and Sweden, including the United States of America, where we have 501c status. All the donations to us attract some non-tax deductible. We're calling all the nations, all the civil society organizations, non-governmental organizations to partner with us. As you deliberate today, we thank you so much for being part of this history. That by 2030, we're having a high percentage of healthy women, healthy family, healthy child. Thank you so much. God bless all of you from Center for Public Health. Thank you.